Aloha, Dr. Okamoto.
Hi, how you doing there,
How
lady?
are you doing over in Honolulu? So you are the perfect person for April, which is Autism Awareness Month, to ask a couple of questions. You're a board certified developmental pediatrician at Kapiolani Women and Children's Hospital, and you are also an advocate for the Act Early screening through the CDC. You are also president of the Hawaii chapter of the American Academy of Pediatrics. So I really wanted to ask a couple questions about autism and maybe just like a curbside consultation, if that's okay.
Great. I'm happy to answer any questions.
So I recently, and it's a very common question, had 9-month-old, uh, normal development patient, male patient, full term baby, all the screenings that we do in the office, like the ASQ, and we also do the survey of wellness and young childhood screening. All of those were normal, but the parents were really concerned that it was flapping, hand flapping, head shaking. For a child that's developing normal at that age, at 9 months, would that be something you would be concerned of and wanted to see?
Usually we would just have our primary care physicians monitor that. We do have kids who get excited and they'll flap their hands, and some kids who have some self-stimulating kind of movements, but that doesn't mean it's something like an autism spectrum disorder.
Mhm.
Autism spectrum disorder comes with a lot of the social issues, so you're probably going to screen out because those screening tools, like the survey, Wellbeing Young Children, they look at like, okay, is the child making eye contact, right? Is the child responding to their name? So you have to have quite a number of things to, sort of start to suggest that you have something more serious. But I think your primary care doctor is well versed in terms of trying to just make sure, watch over it. And if other things start to pop up, then to make the right referrals for them.
Okay, so those tests, the American Academy of Pediatrics recommends at specific ages to do some screening tests. Could you tell us a little bit about what those screening tests should be routinely, and what's the difference of those screening tests compared to the tests that you would be doing later on?
Yeah, so there's like general developmental screening tools. So the ASQ that you already mentioned, the PEDS, those look at development in general. And so those were meant to pick up a lot of different kinds of developmental delays. But I think a lot of professionals also wanted to really have a deeper dive into trying to detect autism. And so the MChat is currently the tool that most practitioners use to screen for autism, usually at 18 months and 24 months. Those months happen to be really important because by then we really start to expect a lot of social behavior, starting to do a
Mhm.
lot more interaction, not only with their family, but with peers. And also, those tools will detect some of the unusual kind of behaviors that a lot of the children with autism have.
Okay, so those should be done during those well visits. Now, can the parents do something on their own if they have any concerns? Are there any reliable resources?
There are, and the CDC has created a package called Learn the Signs, Act Early. So if you Google that, you'll come upon a website that has a lot of nice materials. Parents can actually order books. They're like 1 year old, 2 year old, 3 year old reading books, but they're also a booklet that has the different ages and the different developmental milestones that kids should make at each of those ages. The CDC felt like, wow, we're really moving into the modern age. So they now have an app. So you can download the Milestones Matter app and put in your child's date of birth. It even compensates for prematurity if your child was born premature. And then the app will, at certain ages, just prompt you, hey, how you doing? How's your child doing with this? Are you seeing your child doing this? And might have even a little picture or a short video, and you just answer. And at the end, it tells you, hey, your child's doing marvelous, keep up the good work. Or, ooh, there's some worries. You might really want to see your pediatrician or clinician about the issue. So there are some tools like that, Learn the Science at Berkeley, that parents can use to monitor their kids' development.
For the development, for sure. Would that also show red flags for autism, or do you think there are other things in the works to diagnose, through AI or other apps, specifically autistic, behavior or having those red flags that we look for?
Interestingly, the main screening tool that most pediatricians are using, the MChat, is now more and more showing that we're kind of missing too many kids. When it's positive, most of those kids often have autism, so it's very good for when it's positive, but when they're negative, so we know there's going to be replacement of the screening tool. It might get replaced by something with artificial intelligence. A lot of people have started to look at using AI for diagnosis, so not just for screening, but to actually diagnose the child. The ones that are really good and have a lot of research behind it basically has multiple things. So the parent fills out a questionnaire, but also the clinician, the primary care doctor fills out one. You might send in videos, and then a professional at the company will score that. So some of the better ones will have multiple pieces so that there's a lot of carefulness to it, right? Because these are serious things we're talking about, diagnosing a child with autism spectrum disorder. So it really should be done in a careful way. So that's what happens if the primary care doctor refers to a child neurologist or a developmental behavior pediatrician. There's a lot of careful evaluation using a lot of tools to look into when a child has autism or not.
Yeah, it's very exciting to see all the research done in that and how we can utilize technology, especially we're in Hawaii, and that I think may be actually a big help for us. Um, I know you're very busy, you're very hard to find. So I think empowering parents to how they can see some red flags, reach out to their primary pediatrician, and then coordinating with developmental pediatrics with you is the ideal scenario here in Hawaii. Thank you so much.
You're so welcome. Nice to meet
Hope to
you.
see you soon at the AAP. Bye.